Alright, okay, so hello dears! Ayan. Alright, so welcome to yet again another pre-recorded lecture in our class in Immunology and Serology. And for this lecture, what we're going to discuss now is the serology for viral hepatitis. Okay, so ayan, so welcome. I'm back in the usual venue, yes. Excuse me. Di yung COVID. Charot. Okay. Finally, no, after pila ka weeks na wala sa AK, finally pwede na bumalik. Okay. And I'm here now. Yes, medyo delayed din siya na pre-recorded lecture. So, sorry naman. Sorry. Alright. So, unang, mag-apas na sa mga lectures na, nakulangan or nadugay. But anyway. Alright. So, ayan, we're almost done with IS. Na talaga. This is HEPA. I've recorded syphilis na, diba? So, we're almost done. Gamay na lang dyan. Salmonella and then miscellaneous topics na lang. So, very, very madali na lang. Konti na lang talaga. Okay, so, kapit lang dyan, laban lang. Okay, so push lang dyan. Alright, okay. Ayan, so again, this is viral hepatitis serology. Okay, now we go now to the laboratory testing for your viral infection. So, what are the different methods, no? Or what are the different ways as to how we diagnose your viral infections in the laboratory. Okay, so for diagnosis of viral infections in the laboratory, it's usually divided into two categories. You could perform one, serological assays, and number two, molecular assays. Now, you may be thinking, diba, for viruses, culture, yes, culture is not a routine test or it's not a routine method to diagnose viral infections. Why? Why do you think so? Nako, sana naman. Ma-remember pa. It's because culturing viruses requires very extensive, technical, and expensive na mga equipment. Okay? And recall in your virology, di ba? Yes, that your viruses, they are not cultured in your normal agar, di ba? Like your bacteria. Okay? Your viruses, they require live cells, di ba? So, example, di ba? If ma-remember ba ninyo mga vero cells, ayan. Vero cells, you have HeLa cells, ayan. You have HDF, human basta fibroblasts. Usually these are mga cancer cells, diba? So these cells, viruses require live cells for them to be cultured, okay? Di siya parehas ng mga bacteria that they only require agar, okay? Para mapatubo siya in the artificial environment, which is your laboratory. But for viruses, they need live cells. So vero cells, like this is from the green monkey. Yes, wala ko itong whiteboard marker. HeLa cells came from Miss Henrietta Lacks. If I'm not mistaken, it's a spelling, or I think muna siya spelling. But anyway, so HeLa cells, okay, and you have HDF, fibroblasts or fibroblasts. So these cells usually are cancer cells, okay, because your cancer cells are immortal, they keep on dividing, so there is an unlimited supply of your cells, okay, so that's why you don't have any problem in getting cells if cancer cells are gamito. Alright, so this is one of the reasons why culturing viruses is not a routine method, okay, for diagnosis of viral infections. Unlike bacteria, na culture yun atong gold standard, diba, for diagnosis of bacterial infections. For viruses, again, we rely on two other methods. You have serological and molecular assays. So for serological, we test, we determine the body's, the host's immune response to the viruses, or even the different antigens that the virus has shed or has produced in the body system. Okay? Alright, and molecular assays, we detect either the genetic material, RNA or DNA, of your viruses in your system. Okay? So, we rely on these two routine methods. Okay? Actually, the routine, ang pinaka-routine dyan, is serological assays. For molecular assays, not all hospitals pa talaga in the Philippines have the capability to diagnose viruses or viral infections through molecular assays like your PCR machines, your PCR, mga other molecular tests, diba, in your molecular diagnostics, diba? So, basically, for all hospitals, usually, we rely on serological assays. Okay. And diba, HeLa cells, if you can remember, this is Henrietta Lacks. So, she's a black woman, yes, in which iyahang cells i-harvest without her permission. Yes, there was a documentary about this person, about Miss Henrietta Lacks, yes. And from there, iyang cells kay, I think she had cervical cancer. Yes, and yung cells sa cervix kay harvest from her without her permission. Yes, I haven't watched it yet, but I think it's a good documentary, so you might want to watch it, guys. Okay, alright. Ayan, so those are the different disciplines on how we diagnose your viral infections in the laboratory. Okay, alright. Now, both have become some of the most important and most frequently performed tests in the laboratory nowadays. Okay, and it can be easily performed and rapidly performed, thus playing an essential role in aiding the prompt management of most cases. Yes. Because again, viral infections are one of the most common infections then in the world or of humans, diba? So that's why it's imperative that we use these different assays. Okay. All right. Now we go now to the different serological assays for viral infections. The roles of laboratory medicine, or the roles of us as medtechs, is of course to detect active infections first, to detect active infections. Of course, because we want to make sure, or we want to know if the patient is really currently experiencing a viral infection. Okay, and by then, if we are able to perform our laboratory tests accurately, and then we also send or inform the doctors, their doctors of the patients, with the proper results, with the accurate results, and of course, eventually it can be diagnosed and then treated, diba? So, muna itong goal, dapat yung matreat na as early as possible. Okay? Alright, so to prevent further mga complications. Okay, alright. Next, monitoring the course of infection, yes. So that again, it will give an idea, it will give the doctors the idea as to how, or as to where, asa na padulong, yes, asa na padulong, asa na padulong ang infection sa patient. Is it going to be better or is it going to be worse? Okay, so that the doctors will be prepared, okay, kung silang next course of action, so that they will know what is the next course of action for them in terms of treatment, in terms of management. Okay, alright, next, detecting past infections. Yes, it's important because again, you want to know if your patient really has a history of this. No, it's very important for detecting past infections in the patient's history. Because through patient's history, your doctor can also rule out, or can point to a diagnosis immediately after knowing kung sa history sa yung patient, diba? So, it's very important na history good, okay? Alright, especially now for COVID-19, diba? It's really, really required, for patients who are experiencing mga COVID-19 symptoms to be really honest with their symptoms and with their history. Because again, if they lie about their history, they are putting at risk the doctors, the healthcare system, and even their family, diba? So, muna siya important to be honest yun. And in the history, in taking the history of your patients. Alright, and detecting past infections. Yes, ang daming chika-chika na kulit. Okay, Mark, alright. And lastly, assessing immune status. So, through our tests, serological assays, we determine the titer the antibodies of the patient to this particular disease. So, we know already if this person is protected na ba to this disease, example, hepatitis ba, or is he or she susceptible. Okay. Alright. Now, two main techniques based on your target analyte. It's either we detect virus-specific antibodies, again, which is your host's response to the virus or to the pathogen. And the second one is detection of viral antigens. So, meaning, antigens mismo na gikan sa virus that the virus has shed or has produced in the system of the patient or of the host. Okay? Alright. And usually for virus-specific antibodies, we usually go or test two antibodies. You have IgG, of course, and IgM. What's happening to my... Okay, go ahead. IgG, IgM, diba? For IgG, usually, if positive ang patient for an IgG to a disease, it usually indicates past infection or immunity in most cases. Okay? And for IgM, it usually indicates active or current infection. Okay? Alright. Yeah, diba? Kung IgG, usually it indicates you had a past infection for this particular disease, or you already had an immunity. You are already immune to this disease. Okay, if you have IgG. And for IgM, diba, usually if it's positive, then it's usually indicating that you are currently having a disease. It could be acute infection, diba, or recent infection, diba? And how do we interpret that? It's based on the characteristics of your antibodies, IgG and IgM, diba? And the immune response. So for primary immune response, usually IgM ang una. And then for secondary immune response, we increase siya ng IgM, but IgG ang predominate, di ba, sa secondary immune response. And it will now protect you for a lifetime, di ba? So, lifelong immunity, char. Sana all. Lifelong. Charot. Okay, alright. Ayan, so those are the main components or the main analytes that we test in serological assays for the diagnosis of viral infections. Okay, alright. Now we go now to the main bida, okay, ang star ng Pasko for this lecture, and that is your hepatitis. So we'll first look into the general characteristics of hepatitis. Okay, now for hepatitis, by the name itself, hepa is a prefix that means liver, and titis means inflammation. So if you combine it together, mix it all together, and you know you got the best of both worlds. Shut up. So if you combine the two words, hepatitis, so inflammation of the liver. Okay, and for the causes, there could be a wide range of causes, starting first with the most common, which are your viruses, which is our focus for this lecture, viral hepatitis. Okay, one of the most common causes, viruses. But aside from that, it can also be caused by other non-infectious agents, such as your ionizing radiation, chemicals. You also have autoimmune processes, drugs, and other disease states. And even inyong best friend na si, ayan, alcohol. Ayan, sino ba yung mga medyo ano dyan? May mga medyo uhaw na ba? So mga medyo ano dyan, medyo everyday na, joke lang. Drink moderately, no? I mean, you're all adults, young adults, so it's your life, okay? But please do it in moderation, okay? Anything in excess can be harmful, okay? Okay, always be in moderation, okay? You need this, I'm not advocating, but if you want to practice, if you want to explore, you are free to do so in a way because you're adults already, but please do it in moderation, okay? Alright, ayan. So these non-infectious agents can also cause hepatitis. So as you can see, no, it could only, there's a wide range, as I mentioned, wide range of causes for hepatitis. It's not only viruses. Okay, usually in the Philippines, if may hepatitis or naka-hepa ang patient, usually ang first thing na mas sa mind is like viruses good. But there could be a lot of other sources or agents. Okay, so it's important. And how do we differentiate? It's through this. It's now joke again. So how do we differentiate if the cause of hepatitis are your viruses or the non-infectious agents? We then look into the this is now where your serological and molecular assays will come into the picture. Okay, because it's through serological and molecular assays that if we test the patient and then, example, positive siya IgG for hepatitis B or na-detect ang RNA virus or RNA genetic material sa hepatitis A. So it could already point to the diagnosis, okay, that the patient's hepatitis is caused by the viruses, okay, and not caused by these non-infectious agents. Okay, in these non-infectious agents, serological and molecular assays usually would be negative. We would not detect any viral material or viral reactions, immune responses of the body to the virus, diba? So that's where the serological and molecular assays help, no, in distinguishing and confirming kung asa jugikan ang hepatitis sa patient. Okay? Alright, ayan. So we now focus on the different on viral hepatitis because again, this is our main focus. Siya ang star ng Pasko. Ano na lecture? Okay. Alright, so again, according to 3rd John of 2014, most common liver disease worldwide. And actually, most of the information sa PowerPoint na ito came from 3rd John, guys. Okay? 3rd John na IS, dilihima. 3rd John na IS. Okay, if you want to read, go ahead. Shout out po na Stevens, but mas medyo daghan ang 3rd John din. Okay? Alright, ayan. So it's a primary, okay. So for viral hepatitis, it can be caused by the primary hepatitis viruses or the secondary hepatitis viruses. So for the primary hepatitis viruses, of course, these are your hepatitis, hepatitis, okay, or your hepatitis, the mga viruses, hepatitis A, B, C, D, E, and G. So I don't know why walang F. Okay, this will get F. Charot. Okay, alright. So A, B, C, D, E, and G. This will get F. Kasi may ganang F. Charat! Okay, joke lang. Alright, ayan. So these are the primary hepatitis viruses, meaning these are the viruses talaga that once they are inside your body, their main disease that they cause is hepatitis. Okay? So mudyo na siya yung disease na yung ginakos. Okay? Alright. Or ang iyahang cells na gina-target sa iyong body are your hepatocytes or the cells in your liver. Okay? Whereas for secondary hepatitis viruses, by the name itself, secondary lang. So these viruses, once they infect the body, the first disease that they cause is not hepatitis. So hepatitis is a complication na lang of the diseases that they cause. Okay, so example, EBV, cytomegalo, herpes simplex, diba? So all of them are in the family herpes viridae, diba? So mga DNA viruses. But anyway, as mentioned, secondary lang sila because the hepatitis that they can cause is just a complication of the initial diseases that they cause. Okay, so dili gud mao ang disease na ilang gi-cause. Dili mao or dili ang primary disease na ilang gi-cause kay hepatitis. So example, EBV, di ba? IM, infectious mononucleosis, katong mga other diseases, mga Burkitt's lymphoma. So muna yung mga primary diseases. But hepatitis can happen if there will be complications na. So muna secondary na lang kani sila ng mga viruses. Okay? So we're going to focus with the primary hepatitis ng mga viruses. Okay. Alright. Ayan. Now we go to signs and symptoms of your viral hepatitis. Okay. So disease can occur in 4 acute or chronic forms, which is again acute, fulminant acute. You have subclinical without jaundice, and lastly chronic. Okay. And signs and symptoms are extremely variable. It can be completely asymptomatic, mild, transient, severe, prolonged, or even some cases can lead to death or fatal. Now for symptoms, as mentioned by Third John, I think, or Stevens, but most of the symptoms of hepatitis are like the general symptoms like flu-like symptoms or mga IM-like symptoms like fever, magsipon-sipon ka, mag-cough ka. Alright. But if it's prolonged, no, it can lead to, of course, jaundice, increased bilirubin, and of course, your liver enzymes. And isa itong pinaka-specific na liver enzyme na Clean Chem 2, yes, this SEM. Press the buzzer na. Most liver-specific enzyme is your ALT, okay? Diba? Your alanine aminotransferase, okay? Or, say, old name, SG, it's a man. PT, ayan, okay, alright. So, kanis yan na enzyme ang very specific to the liver, okay? Alright, so how do I remember kung it's ang SGPT and SGOT? So, according to Sir Coloyan, yes, the best, siya ang nahatag sa mnemonic ani. So, kinsa ito maka-form ng LPG, ayan, okay. So, ALT, SGPT, and therefore, AST is your SGOT, ayan, okay. So again, how do I remember? ALT, kung isa maka-form ng SPG, LPG, ALT/SGPT. Ayan. Okay? Therefore, ang AST siya ang SGOT. So kanina mga SG, these are the old names of ALT and AST. Okay? But among the two, or between the two, kinsa ang pinaka-liver specific, it's your ALT and SGPT. So in viral hepatitis, usually mo increase ni siya, or in bilirubin also, which can cause jaundice. And even enlargement of the liver, mga hepatomegaly, yes, and mga tenderness diri, or pain. Yes, pain in the upper right quadrant of your abdomen, where your liver is located. So diri. Sorry guys, medyo malaki yung chan ko. Wala pang abs, char, but yes, I know you get what I mean. So upper right quadrant. So liver, it's here. So na pain na ma-feel dire. Pain, enlargement of the liver, yellowing of the skin, of the sclera of the eyes, which is your jaundice. And of course, in the laboratory, in the chemistry, biochemical panel of your patients, increased ALT, which is the most liver-specific enzyme, and of course, increased din na bilirubin. And aside from that, pwede ding light feces because of if mo enlarge ng liver, ma-obstruct ang gallbladder, ang bile duct, so hindi naka-release ng bile, okay? So, of course, leads to obstruction, di ba? And, di ba, light feces, clay or tan, ang colors of feces, or dark colored urine because of excess bilirubin that is excreted, di ba? Kaya dili na ma-process yung liver, it's not functioning well. Ayan. So, those are some of the symptoms for viral hepatitis. Okay. Alright. And if it's not addressed immediately, it may progress to hepatocellular carcinoma or cancer of the liver. Okay, alright, ayan. Now we go into the forms of hepatitis. First is of course acute hepatitis. By the name itself, acute. Ayan, so sana all cute, charot. So may pa hepatitis kay cute. Anyway, alright. So we have acute hepatitis, by the name itself, it's current, okay, active. Bago siya nahitabo. Typical form associated with jaundice. So you have 4 phases: incubation, pre-ectatic, ectatic, and convalescence or convalescence. So, incubation meaning it's the period of time wherein wala pa kayo na-feel na symptoms or wala pa na-detect ng mga serological markers sa inyong sa system sa inyong patient. Okay? And pre-ectatic, ectatic means increase in bilirubin. So, pre-ectatic, so before pa nagka-jaundice. Ectatic is the jaundice itself, and convalescence or convalescence nahitabo na or naayo na siya. Okay? Incubation period may be few days to many months, and the average length of time is about 75 days for HBV infection. But it can range from as low as 40 days to 180 days. Okay. Now, fulminant acute is the rare form of hepatitis na ay hepatic failure. Okay? So, pagka-hepatitis niya, diretso to hepatic failure or muy consequence. So, fulminant acute. Okay. And next is, of course, subclinical hepatitis without jaundice. The patient is experiencing hepatitis but walay symptoms, walay jaundice na nahitabo, and there are no demonstrable antibodies in the serum. Okay? But the patient is experiencing hepatitis. Okay. And lastly, for chronic hepatitis, long-term, dugay na. Okay, sana all. Dugay na. Dugay na siyang hepatitis which led to, again, necrosis and inflammation and even the death of your liver cells, diba? Necrosis and cancer. Okay? So, dili tagadahan o acute or chronic sa diseases. But in relationships, we go for chronic. Ayan. So, dapat, okay, ang aim is chronic na relationship. Dapat long-term. Char, pero kung gusto niyo na acute, kayo na bahala dyan. Basta both parties are well-informed. Okay. Yes, Mark? Okay, so chronic na. Chronic long-term na, guys. Okay, charot. Alright, okay. Now, we go on to the different primary hepatitis viruses. And this will be our focus in the next videos na. We'll go through each individually in their different serological tests, no? Starting first with hepatitis A and E. Magsugod na sa AE because they have the same mode of transmission. And then followed by your C, B and D, and lastly, the hepatitis G. So, nara ko yung reason why I group them accordingly. Okay? So, I'll see you in the next video, and we'll start now with your first primary hepatitis virus, and that is hepatitis A. Alright.